Hey everyone, welcome back. Today I want to talk about one of the purest gifts a mother can give, breast milk. It's nature's perfect food for babies, packed with the right balance of nutrients, antibodies, and love. If you're a new parent or expecting, here are the essentials you should know. Breast milk changes with your baby's needs. From the first thick colostrum, tiny but powerful, to mature milk that follows, every feed supports growth, immunity, and brain development. It contains proteins, healthy fats, vitamins, and live cells that help protect your baby from infections. Beyond nutrition, breastfeeding builds a strong emotional bond. Skin-to-skin contact releases hormones that calm both mother and baby, and those quiet feeding moments help with attachment and trust. Practical tips to get started. Try to start within the first hour after birth if possible. That first latch helps both of you learn. Find a comfortable position, cradle, cross-cradle, football hold, or side lying, whatever works for you. Use pillows to support your arms and baby. Make sure baby latches deeply. Mouth wide, lips flanged out, chin touching the breast. If feeding is painful beyond the first few seconds, break the latch and try again. Feed on demand. Watch for hunger cues like rooting, smacking lips, or hand-to-mouth movement, rather than strictly following the clock. Newborns often feed 8 to 12 times a day. Common challenges and quick fixes. Sore nipples, check latch and position first. Apply expressed breast milk and let nipples air dry. If pain continues, talk to a lactation specialist. Engorgement, frequent feeding, warm compresses before feeding, and cold packs after can help. Hand express or pump a little if baby can't latch comfortably. Low supply worries. Increase skin-to-skin time and feed more frequently. Ensure you're staying hydrated and eating enough. Power pumping, short pumping sessions back-to-back can help stimulate supply. Mastitis. If you have flu-like symptoms plus localized breast pain, redness, or warmth, keep feeding and contact your healthcare provider. You may need treatment. Pumping and returning to work. Pumping helps maintain supply and allows others to feed the baby. Start with a few short sessions and build a routine. Store milk safely in sterile containers and label with date and time. When planning to return to work, practice pumping and build a freezer stash. Talk to your employer about break times and a private space for pumping. Nutrition and self-care for breastfeeding moms. Eat balanced meals with whole grains, protein, fruits, vegetables, and healthy fats. Stay hydrated, drink when you feel thirsty and keep a water bottle nearby during feeds. Rest when you can. Ask for help from family and friends. Breastfeeding requires energy. When to seek extra help. If baby isn't gaining weight, if feeds are extremely painful, or if you have persistent concerns about supply, reach out to a pediatrician or a certified lactation consultant. They can offer individualized support and solutions. Breastfeeding isn't always easy, and every mother's journey is different. Whether you breastfeed for weeks, months, or a year, you're doing something amazing for your baby. Trust yourself, get support when you need it, and remember, fed and loved is what matters most. If you'd like, I can make a short version of this script for a 60-second reel, or write a friendly call to action and video outro.